Almost 2,000 years ago, the first descriptions of asthma were made by a Greek physician, Hippocrates, the father of medicine. When observing his patients, he noticed them struggling with cough, difficulty breathing, chest tightness, and fatigue. Now, Hippocrates believed that diseases resulted from an imbalance of the four bodily fluids and sought to restore balance through various treatments such as diet, exercise, and herbal remedies. While Hippocrates may not have had a specific term or detailed understanding of asthma as a medical condition, his observations and descriptions of respiratory symptoms laid some of the groundwork for later developments in the understanding and treatment of respiratory disorders, including asthma. But still, it wasn't until the late 1800s, early 1900s that the true definition and understanding of asthma came about. Initially, it was thought that asthma and asthma attacks were brought on by spasms in the tubes that deliver air to the lungs, the bronchioles. However, clinical trials in the 1980s proved that asthma was caused by inflammation. Inflammation is a medical condition that can cause a variety of symptoms, including swelling, rawness, and pain in an area of the body. It's common where we have injuries or hurt ourselves. Inflammation usually helps the body heal itself by delivering more blood and nutrients to the area. However, in people with asthma, this causes the airways to tighten, making it harder to breathe and causing uncomfortable pain in your chest. The cause of asthma is varied and is difficult to narrow down to one factor. Some people may have asthma as a genetic trait, while others may have been exposed to environmental or allergy conditions leading to the disease. These can include dust, mold, pollen, or chemical fumes. Unfortunately, there's no cure for asthma. However, most people with asthma can manage their symptoms well with medication. When you think of asthma, you probably think of an inhaler. Inhalers work by pushing aerosolized medicine into your bronchioles and lungs. There are two types of medicine in most inhalers. The first is bronchodilators. This may sound like a complicated word, but let's break it down. We have broncho, meaning bronchioles, and dilate, meaning to open. So when you put the two words together, it means to open the bronchioles, which allows oxygen to get through these passages and into the lungs. The second medicine in inhalers is steroids. These types of medicines reduce inflammation and may help take away sensations of burning, heaviness, and other symptoms of asthma. People with asthma can live active and healthy lives with proper care. While someone who has asthma should use their inhaler as instructed, they should also monitor an air quality index for when they should stay inside or reduce intensity of exercise. Reducing asthma triggers like dog hair, excessive dust, or strong odors can also help. Other things you should do: you should take care of your mental health and do your best to manage stress. Not always easy, but there are resources you can use. Two Rivers Public Health Department actually has one called Credible Mind. Check it out at trphd.crediblemindcom. And lastly, but arguably the most important, create an asthma action plan detailing your medication, personal signs of asthma attacks, and when to seek emergency care. The month of May is World Allergy and Asthma Awareness Month. Say that 5 times fast. We already told you about allergies, so now it's asthma's turn. Finding a good support system and the right medication is key to living a happy and healthy life with asthma. Asthma has significant implications for public health due to its prevalence, impact on quality of life, and healthcare costs. Asthma is one of the most common chronic respiratory diseases globally, affecting people of all ages. According to the World Health Organization, around 262 million people worldwide currently suffer from asthma. By addressing asthma comprehensively through public health interventions, including prevention, education, and research, it is possible to reduce the burden of this chronic disease to improve the quality of life for individuals living with asthma. As always, stay happy and healthy. Until next time.